Exercise 33 deals with cardiovascular physiology. The cardiac cycle is composed of two parts: systole, which is when the heart chambers are contracting, and diastole, when the heart chambers are relaxing. So those sounds that you hear, that lub-dub sound, the lub is when the AV, the tricuspid and bicuspid valves are closing, and then the second sound, that dub sound, is when the semilunar valves are closing, the pulmonary and aortic valves are closing. You can hear when the valves are closing. Excuse me. By this diagram, you can see the placement of where you'd place the stethoscope to hear the particular valve of those four different valves. A heart murmur is an abnormal kind of gurgling sound that you hear because the AV valves are not closing completely, and there's some backflow of the blood from the ventricle back into the atrium, and you hear kind of that little gurgling, swishing sound. Mitral valve prolapse. This is when the mitral valve between the left atrium and left ventricle does not close completely. That's fairly common to have a minor prolapse. Major prolapses would be caused when the chordae tendae would be ruptured or there's damage to the cuffs, and that can be very serious. Blood pressure is the force of the blood on the walls of the blood vessels themselves. The blood is moving along a pressure gradient, meaning it moves from a high pressure area to low pressure. The pressure is highest in the aorta just as the blood leaves the heart, and then as the farther away you get from the heart, it gradually decreases. By the time it gets back to the right atrium, it's almost at zero. When you take blood pressure, you end up with two numbers. The two numbers are systolic pressure and diastolic pressure. The systolic pressure is the maximum pressure, that's the top number, and it's representing the force that the left ventricle is exerting. The diastolic pressure is the lower number, it's the bottom number, and that's the resistance to the blood flow in the arteries. You measure it in millimeters of mercury. Average blood pressure is, used to always say it was 120 over 80. Now some people prefer it to be more 110 over 70, just trying to get it down in the general public. Usually it's going to be measured in the brachial artery. You keep it the same level as the heart, so that way the effect of gravity, you rule out that as a variable. It's fairly close to the blood pressure in the aorta. The procedure that you're going to use for measuring that blood pressure is that you take the blood pressure cuff, which the scientific name for that is the sphygmomanometer. You place it around the arm. The cuff is going to be inflated. You need to get it if the higher number is 120, you certainly want it above that. So you need to increase and inflate it to well above 120. Some people who have high blood pressure, obviously, you're going to have to get it above that highest reading. What that is going to do is close off the brachial artery. And then you slowly reduce the pressure, release that pressure until you hear the sounds. The first sound will be that upper number. You continue, the last sound will be the lower number. And by the time you have released all the pressure on the cuff to less than about 70, you should have normal flow through that artery. That's why you don't hear the sounds anymore. So there's normal flow going through. So you're going to use your sphygmomanometer and a stethoscope in combination. I do know that, yes, of course, now they have easier, quicker ways at home for measuring your blood pressure with, say, a wrist blood pressure cuff, but usually most places in a hospital clinical setting are going to want you to use the cuff. So this is showing how, from a diagrammatic drawing, that on A, that's normal blood flow going through. You put the cuff on, you pump up the cuff, you temporarily are restricting flow through that brachial artery. As you start to relieve the pressure out of the cuff, Then you hear that first sound, that's when the blood first starts to flow through. Last sound, you're now down to uh, normal blood flow. So after the last sound, the reason why you don't hear is the lower pressure. After that is you have resumed normal flow through. As I said, normal blood pressure is 120/80. The mean arterial pressure is the diastolic pressure plus 1/3 of what the pulse pressure is. The pulse rate, uh, there are different areas where you can measure the pulse. It is that rhythmic expansion, recoil of the arteries. There are major pulse points: the temporal, the carotid, the radial, and the popliteal. The clinical manifestations are hypertension and hypotension. Hypotension is low blood pressure. Orthostatic hypotension is temporary. It might just be due to sudden change in your position. You were lying down, you suddenly stood up, and you feel lightheaded. That's what's going on. You have a sudden drop in the blood pressure. Chronic hypotension is often due to poor nutrition. It may also be due to certain disorders such as hypothyroidism. Acute hypotension, where you suddenly have severe drop in blood pressure, may be due to shock, and you need to address what's causing the shock. You don't just treat the symptom, treat the cause. Hypertension is high blood pressure. Primary hypertension, where there's no underlying cause. It may be genetics, it may be environmental factors being involved. Secondary hypertension is due to results of some disorder or disease. You may have kidney disease, you may have endocrine disorder, etc.